Good afternoon and welcome to Washington State Public Health Association's December webinar on the state budget for the 2013-2015 biennium. Before we get started, I just wanted to go over a couple of technical issues. On the screen right now, you see the control panel. We will be accepting questions today through the control panel in the questions box. If you type your questions in, we will monitor them and pose them to the presenter. Secondly, the webinar will be recorded and the slides will be available after the presentation, hopefully by the end of the week. And if you have any questions about that, you can feel free to email me at bscota@wfpha.org. Okay, Jennifer.
Hi, this is Jennifer Mumm. I'm on the board of the Washington State Public Health Association, and I'm very pleased to, again, get to work with Kim Justice on this webinar. Kim is a policy analyst for the Budget and Policy Center, and prior to that, she was a policy analyst at the House Democratic Caucus for the House of Representatives in Olympia. And she worked on a variety of issues there. So she has a really great background, understands budgets and policy very well, and I think has a great presentation for us today. So I just wanted to reiterate what Betsy said about asking questions. Kim's going to build in some time in a couple places in her presentation to take questions, and would love to have your questions while we have her as such a great resource today. So thank you very much for joining us, and Kim, I'll turn it over to you.
Okay, thank you, Jennifer, and hello, everyone. By way of a quick introduction to the Budget and Policy Center, we're a nonpartisan research organization that works on budget and tax reform, and really with a vision towards creating a prosperous state. And it's a great opportunity to talk with you today because this really is an interesting time in our state. We have new leadership with the incoming newly elected governor. There's some new leadership in the legislature. We have a new mandate from the courts to fund education. We have federal health reform that we're preparing to implement in our state. And
welcome to GoToWebinar, Web Events Made Easy.
Presentation is to give you a big picture understanding of the state budget and how our public investments have fared in the wake of the recession, give you a solid grounding in the challenges that are facing us, and finally try to end on at least a little bit of a hopeful note and give you some concrete solutions for how we move forward. So to that end, I'll be making 4 points in my presentation. Next slide, please. The budget is a reflection of our values. Investments have been cut to the bone. We have major challenges ahead, yet we do have solutions. So to the first point, next slide, please. Oops, sorry, one more, back. Actually, it's fine, you can sit there, sorry. So when most people think about the state budget, they think of numbers, spreadsheets, and often people get pretty overwhelmed. But what we need to realize is that the budget is simply a reflection of our priorities and values. In fact, the budget is the most powerful tool we have for social change because it determines who gets what and how much. Next slide. So at the Budget and Policy Center, we have created what we call the Progress Index, which basically distills all of state spending into 4 value areas. We have healthy people and environment, and that covers investments that protect the air we breathe and the water we drink. It makes sure that the public is safe from disease and natural disasters. And it's also investments that ensure that families, people with disabilities, seniors, and others have affordable health coverage. Economic security refers to investments that help people get and keep a job, things like job training and childcare. Thriving communities are investments in public safety, access to arts and culture, parks, and also promoting economic growth and development. And then finally, education and opportunity, which refers to our investments in the entire education pipeline, everything from early learning through higher education, including worker retraining programs. So my challenge to you is, when you think about the state budget and what budget decisions mean, to really think about these widely shared values, because that is what the budget is all about. Of course, most people who deal with the budget are not accustomed to thinking of it in this way, and mostly the budget gets framed by how much we spend by state agency. Next slide. So this is a common picture of what our state budget looks like when viewed that way, and this is probably similar to what you've usually seen when you see a breakdown of state budget spending. And when you look at it this way, you can see we spend our largest expenditures on K-12 public schools. The next largest chunk is for healthcare through the Healthcare Authority. You can see the Department of Health is included in here. It's a very small chunk of the budget, just a half of a percentage point. But we can translate all of state spending into the values that I just mentioned. Next slide. And when we do that, this is what the state budget looks like. You can see that the majority of spending is on education and healthy people. And the smallest portion of the budget goes towards economic security, which, as I mentioned, are supports that help people find and keep a job, like child care. To my second point, next slide. So the budget is a reflection of our values, and in the last 4 years, in the wake of the recession, those investments have been greatly diminished. Next slide. And what we're seeing is this growing divide or gap. And if you click the slide one more time, we'll get the, hopefully get the little animated effect here. So, so it's a gap between our needs, such as education, healthcare, public safety, and then our ability to meet those needs. And we're failing in our ability to meet those needs because we're simply not taking in enough revenue. So let's take a look real quickly at the revenue side. Next slide, please. What this graph shows is near general fund state collections for 2008 projected into 2017 adjusted for inflation. And you can see that our revenues have been drastically reduced in the wake of the recession. And it's not hard to figure out why. There's been a lot of job loss. People have lost some or all of their income, so naturally they're spending less. And since we're a state that is heavily reliant on our sales tax for revenue, when people spend less, we really feel the impact of that in the revenues that we take in to fund the things we care about. Right now in 2012, revenues are 12.5% below 2008 levels. And while we are seeing some modest recovery, revenues are not projected to return to their pre-recession levels in the foreseeable future. So we're taking in less revenue at the same time as our needs are rising. And the needs are rising because our population is continues to increase, which means there's more demand on our health and education and transportation systems. Also, again, because of the recession and the change in people's incomes, more people seek state services. When people lose jobs, they seek out opportunities to go back to school or get retraining. And when incomes drop, it means that more people are qualifying for our state healthcare programs and other services. So healthcare is actually one good example of the rising needs. Next slide. So since the recession, about 200,000 people have lost employer-provided coverage. And so not surprising, there's been a large increase in the number of people accessing public health insurance during that period. So our needs are increasing and our ability to meet them is decreasing. And it's important when realizing this dynamic that the legislature had choices, and they've been faced with tough decisions about how to deal with this growing divide between our resources and our needs. And the options they have before them are to raise taxes, make cuts, or do some combination of both. But the primary response has been to make cuts. Next slide. In fact, since 2009, there have been over $10 billion in cuts compared to just $600 million in tax increases. So cuts have actually outweighed tax revenue 17 to 1. And next slide. The impact of those cuts have fallen most heavily on education and healthcare, which is not surprising when you think back to the earlier slide about where we spend most of our state money. It's in education and it's in healthcare, so naturally budget cuts are going to come out of those areas as well. I'll just go through a few examples of the impact of budget cuts. Next slide. So students are paying over half of the cost of their four-year college education through tuition. So we've seen skyrocketing tuition. Seniors are paying more for their prescription drugs. Over 20,000 families have lost those work supports, those supports that are part of economic security that help people find and keep a job and really help keep families stable. And more than 66,000 adults have lost health care coverage through the basic health plan. And then when looking at some of the impact of cuts in Department of Health and public health, we've seen reductions in the monitoring of water systems, some reductions in maternity support services, environmental health efforts, health screenings, and other areas. So that's a brief look at where we've been and where things stand. Next slide. And now I want to transition to talk about what's ahead. So what are the challenges that we face moving forward? Next slide. So what this graph shows are the shortfalls facing our state, both in the next biennium and the 2015-17 biennium. And you'll see there's two different categories to this shortfall. The maroon bars reflect our shortfalls from simply maintaining our current obligations. So in the next biennium, we're facing a $900 million shortfall. And in the following biennium, it's about $170 million. But that's only one part of our challenge. We all know we are required now to be making investments to fully fund basic education, and that's due to the McCleary versus Washington court case in which the state Supreme Court ruled that the state is failing to meet its constitutional obligation to fund basic education. And I have some slides later, and I'll go into more detail about that. But essentially, we must fully fund basic education by 2018. So we need to start taking steps towards that goal. And what those green bars show are our minimum responsibilities, the minimum cost to start to begin funding McCleary. So when you add that in, the shortfall really looks like $2 billion in the next biennium and almost $3 billion in the following biennium. So I'll take a little bit of time to walk through the various components of this budget outlook. Next slide. So the first thing we have to look at is what it takes to maintain our current services. And we all know that things cost more from year to year. So it costs more tomorrow to provide the exact same services that we provide today. In legislative speak, this is referred to as maintenance level. And it costs more because our population grows, so we have more kids in public schools. We have demographic changes, particularly our aging population and the aging of the baby boomers really increases cost in long-term care, which is one of the more expensive forms of health care that we provide. And then, of course, there's general inflation, which increases costs. Next slide. So this return of suspended policies really refers to actions taken by the legislature in the past. We've seen a lot of eliminations of programs and different forms of spending, but we've also seen this suspension of policies, which means that they're temporary. They are suspended during the time that the legislature takes that action and for that budget period, but in the budgets going forward, they're built back in. So a couple examples of those are Initiative 732, which called for salary increases for teachers, and also paid family leave. Paid family leave is a policy that was suspended, but by law benefits are supposed to begin going out in 2015. So these costs show up when we look at the budget going forward. Next slide. Collective bargaining is another area. There are a couple items in the forecast or the outlook that include collective bargaining, and that's a previous collective bargaining agreement to include a pay step for state employees, and also the restoration of salary decreases for teachers and state employees. So there's a couple items in there already, but we largely don't know what impact collective bargaining will have on the budget yet, because those collective bargaining agreements haven't been reached yet. So any changes to state employee health care and pay will be reflected in the budget going forward. Next slide. So with the implementation of the Affordable Care Act, we have both the policy and budget implications for our state. And I'm going to focus just on Medicaid expansion here because it really has the most significant impact on our budget, and it's also an area where the legislature needs to make a major decision. Essentially, what Medicaid expansion allowed was for states to expand current Medicaid up to 138% of the federal poverty level, which translates to about $15,000 annually for an individual, or $26,000 for a family of 3. The other thing it did is it got rid of this what's called categorical eligibility, where currently to qualify for Medicaid, you have to be poor and something else, like pregnant or disabled or have children. And the expansion did away with that. So it's now simply an income eligibility measure. When the U.S. Supreme Court ruled on the ACA, one of the things they decided was that Medicaid expansion is optional. So states can forego expansion without penalty. So if a state decided they didn't want to participate in the expansion, they wouldn't face any penalty, or they wouldn't jeopardize their current Medicaid match from the federal government. So that means that states have to make a decision, and we're seen as a state that is leaning in the right direction, meaning that we're leaning towards expansion. But I would say that we still have to continue to make the case for why this is a good thing for our state, and not take it for granted that we're going to opt in. So this is actually a bright spot in the budget because it actually saves the state money, and I'll explain why. Next slide. So for the first 3 years of the expansion, the federal government picks up the entire tab. So they contribute 100% for all the newly eligible participants. And then after the first 3 years, their contribution starts to decrease little by little until it gets to 90%. And the federal contribution stays at 90% from 2020 and beyond. So that's a mere 10 cents for every dollar that the state would pay. And so the federal match is a great incentive for why this is a good deal for our state. Additionally, we can realize savings because we're currently paying 50% of the cost for some populations who will be included in the expansion and will soon get the increased match. That population is the basic health and disability lifeline population. There's about 43,000 people who benefited from an early expansion waiver that we got in 2011. So since that time, the state's been paying 50% the federal government's been paying 50%, whereas in the past, these have been state-only programs, meaning that the state has paid the full cost. So in 2014, these folks will get 100% federal contribution. So that will save our state money. We also will save money in things like mental health, chemical dependency treatment, HIV and AIDS treatment, because these are things that will be covered under the expansion for the newly eligible folks. So those are sort of built-in areas where we will save costs. There's also some additional areas and programs where we could realize even more savings depending on the choices that the legislature makes. So we have some other programs like the Take Charge Family Planning Program and Breast and Cervical Cancer Program that could be modified or eliminated altogether depending on the choices that are made. And so taken together, the savings that we could see could be anywhere between $100 to $200 million in the first biennium, again, depending on the policy choices that we make. So fiscally, this is a win for our state, but money is not the only thing that we care about. Of course, this is a great opportunity to expand coverage to hundreds of thousands of more people, and we're expected to be able to expand coverage to about 261,000 new people through the expansion. Next slide. Oh yeah, one back. There you go. So again, across the state, we see that the expansion offers a great benefit. In particular, it offers a really great benefit to eastern and rural parts of the state. What this map shows is the percent of uninsured people who will be eligible for expansion. So, for example, in Yakima County, 40 to 50% of the uninsured people in that county will be eligible for Medicaid expansion. And taken as a whole, about a third of the uninsured population in our state will gain coverage. Next slide. So the last component I want to talk about is the McCleary ruling on education. So as I mentioned, this is the court case that ruled that the state is failing to meet its constitutional obligation to fund basic education. And what the Constitution says is that it's the paramount duty of the state to make ample provision for education for all children. And there's been plenty of debate in prior court cases and within the legislature about how to define that. So how to define what we mean by ample, and also how to define what we mean when we say basic education. And I suspect that we will continue to have some debate about what constitutes ample provision. But what the court's looking at in terms of what the obligation is for the state moving forward is they're looking at what some actions that the legislature took in the last few years to redefine and reform basic education. So there were two bills that passed the legislature, House Bill 2261, which redefined the program of basic education and created a new system for funding. And then a subsequent bill, House Bill 2776, laid out more specifics around that. So what it did was it laid out the first steps of implementation, and it put numeric values to the new system of funding. So what that means in terms of state spending can sort of depend on who you ask, but our state does have estimates for the required components under House Bill 2776, and that represents really the floor of what we're required to do. Next slide. So I'm going back to this graph just to kind of show again what that cost obligation is. So when I said this is the minimum that we have to provide for McCleary, this reflects what's in House Bill 2776 because it's specific steps laid out for what we need to do in the next two biennia, but it's not the full picture of what's required under the new definition or the new prototypes for basic education. So the question really is, how much do we contribute towards that and when? reminding you that we have to phase in implementation until basic education is fully funded in 2018. And there's an education task force that's working to answer this question, and their task is twofold. One is that they need to figure out what do we need to spend. So what do we need to fund in the next few biennia, and how do we pay for it, either through cuts or revenue. And next slide. This spending need chart reflects some of their recent work, although not their most recent work, because they actually met this morning. They could still be meeting right now, actually. But at the last meeting, they started to talk about what they think should be spent towards basic education. And you can see House Bill 2776 and some line items under there, because that bill required some funding for transportation, maintenance, supplies, and operating costs, reducing class size in kindergarten to 3rd grade, and beginning to phase in full-day kindergarten. So those are the items that I mentioned are the floor of what we need to do. In addition to that, they want to allocate some funding for Career and College Ready plan, which is which calls for increased instructional hours so that kids can get to 24 credits, which is the new requirement for graduation, and also increased funding for compensation. But one thing to note about that is this is compensation for administrative staff and classified staff. It's not including compensation for certified staff, which are teachers. So this is not a spending plan that has been agreed upon yet by the task force, but this is where the direction they're heading in. And when you look at their balance, there's the shortfall, if you fund all these things, is $2.5 billion, which is $500 million more than the outlook I just showed you. So I know it's a lot of information, so I thought I would just pause right here and take any questions before I start talking about the next section, which will focus on solutions.
We haven't had any questions come in yet.
Okay, I keep going. All right, so I'm going to move on to the solutions piece because, as I just showed you, there are a lot of challenges before us, and they're big challenges. And in order to meet them, we have to do a couple things. We have to make some structural changes to our tax system and our budget, and we also have to come up with a lot more money if we're going to meet our needs. And we can't really look to cuts to balance our budget. Further cuts would really jeopardize our ability to fully recover from the downturn, would jeopardize our ability to get people back to work, and jeopardize our future prospects and our ability to really be a prosperous state where opportunities are available to everyone. So I've divided the solution section into two categories. One category is how we can make our tax system more transparent and equitable. And the other category is around revenue and how do we create new revenue. Next slide. And one more time. There you go. So, so one of the flaws in our current tax system is that it lacks transparency. We spend billions of dollars in hidden spending through tax breaks. These go to individuals and corporations, and they include everything from sales tax break for out-of-state residents who cross borders to shop in our state, business and occupancy credit for high-tech firms, and it also includes our sales tax exemption on food and prescription drugs. And many people have gotten into a debate in recent years over the merit of particular tax breaks, and questioning whether some of those should be closed so we can invest in things that are more important. And that is a worthy exercise, and it's something that we continually look at as well. But we also argue that there's an even bigger systemic problem with the way we account for tax breaks. Currently, tax breaks get enacted and they stay on the books in perpetuity without undergoing any regular review. Most tax breaks don't even have a stated purpose or any way for us to measure their effectiveness. So because the majority don't have any expiration, they continue on and they forego any review or scrutiny. Next slide. As this slide shows, only 10% or 65 tax breaks have an expiration date. And what we would argue is that tax breaks are really spending decisions, and they should be treated as such. They have the same impact on the budget as appropriations do. And so we think they should undergo the same scrutiny as other budget decisions. And one way to address that would be to require renewal dates for tax breaks. Setting an expiration date for tax breaks would force them to undergo public and legislative evaluation in order to be renewed. And then that way they could also be compared alongside other forms of spending, such as investments we make in healthcare and early learning. And we also think that tax breaks should be required to have measurable outcomes, whether that's job creation or other positive impacts on our economy. Next slide. Another policy, the working families tax rebate, would help address another flaw in our revenue system, that it is upside down. And when I say it's upside down, what I mean is that the poorest residents pay more in taxes as a share of their income than the richest Washingtonians. So this is another way of saying that our tax system is regressive. Next slide. This graph illustrates that point. So as you can see, as a share of their income, families making less than $20,000 a year pay 17% in taxes, while those making over $537,000 a year pay just 3%. And according to the Institute on Taxation and Economic Policy, we have the most regressive tax system in the country. The working families tax rebate is one way we can begin to address that inequity. The rebate's modeled off the highly successful earned income tax credit at the federal level. And what it does is it lowers the tax responsibility for people with lower incomes by issuing a rebate for the portion of the taxes that they paid. In our state, we would simply add 10% to whatever amount someone gets from their federal earned income tax credit. So in our state, we don't have a sales or an income tax, so the rebate would act as a refund for a portion of the sales tax paid by families. And the amount someone can claim at the federal level is from about $500 to a little over $5,000. And these are, the rebate goes primarily to working families with children and would help about 400,000 Washington families. Next slide. This graph shows the average amount a family would receive from the state working families tax rebate. You can see it's based on income. So those making less than $21,000 would receive an average check of $241. This policy was actually enacted in law in 2008, and Department of Revenue has made significant progress on the administrative side, but the legislature has not funded it, so we have not had any checks go out to folks yet. So it's still something that we're working on in terms of getting the funding there for the rebate. So those are just a couple of ways that we can make our tax system more equitable and transparent. Now I'll talk about a few ways that we can generate additional revenue. Next slide. So one of the revenue options would be to extend the 2010 tax increases. And from a policy standpoint, this is probably the most obvious revenue option. Since these taxes are currently already in place, we would simply be extending them. You may remember in 2010, the legislature passed some tax increases. You may remember because there was an initiative on the ballot later that year, Initiative 1107, which repealed some of those taxes. And it specifically repealed the tax increases on candy, bottled water, and soda. So that was a successful effort to repeal those taxes. But there were some that remained in place. There was we temporarily raised the B&O tax surcharge on services by 0.3% percentage point, and also imposed higher taxes on beer produced by large multi-state breweries. So those are set to expire. The legislature could extend those tax increases, and the estimates are that we could bring in about $536 million of Biennium if we extended the B&O tax surcharge, and about $120 million if we extended the beer tax. Next slide. Another option would be to extend the sales tax to consumer services. Currently, the sales tax is applied to the goods we buy, but not services such as hair and nail salons, spa treatments, teeth whitening, attorney services, even though our economy has actually become more service-based. Next slide. In this graph, you can see that goods as a share of personal consumption have been in steady decline. And you can see that point beginning in the 1970s when our economy really switched over from a goods-based economy to a services-oriented economy. So extending the sales tax to services would help modernize our tax system to better match our state's current economy, not the one we had in 1935. It would also generate new revenue and give the state a broader and more stable revenue stream. Estimates for extending the sales tax to consumer services are about $200 million of Biennium. Next slide. So finally, one of the boldest proposals would be enacting a tax on capital gains. This has the potential to change our tax system to address some of the regressivity that I talked about earlier. And it also has the potential to bring in a lot of revenue. It's a tax that would actually keep pace with our economy, unlike the retail sales tax. So first, what are capital gains? Well, they're the profit from sales of corporate stocks, bonds, real estate, and other financial assets. So they're assets that are held by the wealthiest Washingtonians. To be more specific, they're held by the wealthiest 3% of Washingtonians. And in 2011, 96% capital gains went to millionaires. So enacting a small excise tax on capital gains would raise significant revenue from only those who are actually most able to pay it. And I'll just highlight just a few of the policy details. This proposal would be tied to the federal capital gains tax, which makes it really easy for the Department of Revenue to administer. We would propose somewhere between a 5 to 6.5% tax on capital gains and build in a $10,000 exemption. And other important things to note are that retirement is exempt. It's exempt under federal law, so we would exempt it under state law as well. That means that 401ks, 403bs, pensions, the savings and distribution of those would be exempt. We also recommend exempting real estate altogether on the first home. At the federal level, the exemption is $500,000, but we think in our state, since real estate makes up a very small portion of capital gains to begin with, that it would be the best policy to fully exempt it. So what are the estimates for revenue? Well, at 5% tax, the estimates are that it would bring in about $1.4 billion of Biennium. And of course, if we increased it to 6.5%, that would translate into even more revenue for our state. Next slide. One of the attractive qualities of capital gains is that they grow much faster than retail sales, the tax base, which we're currently so dependent on. This graph compares the annual growth of capital gains compared to retail sales, and as you can see, there really is no contest. Secondly, the stock market recovers much more quickly from a recession than other components of the economy. Next slide. And that's what this graph shows. So since July of 2009, when the recession officially ended, the stock market has grown by 50%, while consumer spending has grown by a mere 14%, and the growth is even less in wages and salaries and employment. So the bottom line is that capital gains would be a modest tax on large investment profits paid by the richest Washingtonians. And it would go a long way towards stabilizing funding for public investments and helping our economy to recover. Next slide. So that concludes my presentation. I'm happy to answer questions, and I also want to make a pitch that we're having a policy conference next Thursday, December 13th. It's at the Seattle Convention Center. We have Van Jones coming as our keynote, and there will be a lot of great sessions that will drill down and deeper into some of these things I talked about, such as McCleary and health reform and the budget. So if I make the pitch for folks to come, and if you want to get more information and sign up, you can go to our website, which is on the slide, budgetandpolicy.org.
We have had a couple of questions come in.
Okay.
The first one is, what is the timeline for the collective bargaining negotiations and decisions?
That's a good question. I don't know the exact timing, but they're typically, I believe, included in the governor's budget. So that timeline, from what I'm hearing, the governor's budget is probably going to be out around December 18th. So that's just a couple weeks away.
And then the next question is, what is the likelihood of a state tax on capital gains happening in the near future?
Mm-hmm. That's a good question. We've had some progress on this, actually. Last year, Representative Lori Jenkins introduced this bill, and so it really got the conversation started. Since that time, this proposal has been teed up with some legislators in terms of possible revenue solutions. I've seen it show up actually in some of the education task force materials, and like I said, they were meeting this morning and I wasn't able to attend, but I was looking at some of the materials online, and one of the proposals from the Senate Democrats on that task force had a recommendation to do a capital gains tax. So it's percolating. I think, as people look at the magnitude of the shortfall, we know we need to do something pretty big to bring in that amount of new revenue. So the conversation's happening. It's really hard to say and predict what might happen in the next session or the session after that. But there's definitely a lot of effort towards this and a lot of grassroots mobilizing and organizations that are involved in the advocacy effort.
Okay, the next question. Does the latest Tim Eyman initiative require over 60% of the vote in the legislature to pass a capital gains tax?
Yes, it would. We currently have the 2/3 requirement to pass any tax increase in the legislature, so that is current law. Eyman's initiative this year, 1185, was in essence, he said he was going to run that initiative every 2 years. Since the legislature can change initiatives after 2 years. He sort of committed to, I'm gonna run this initiative every 2 years to make sure it always stays in law. But this is currently being taken up by our state Supreme Court about whether or not it's constitutional to require the legislature to have a 2/3 vote to pass any tax increase. And we expect that they will actually rule on that in the next 2 weeks or 3 weeks. It should be before the first of the year. And so that's going to have major implications for what happens during the next budget cycle and the decisions that the legislature can make, because if they rule it to be unconstitutional, that opens a door in some respects for a simple majority vote on any tax increase. But the specific answer to your question is yes. Under current law, a capital gains tax would be held to that 2/3 majority vote requirement.
The next question is, what is the new governor's position on these revenue proposals?
Well, we would say, unfortunately, the new governor, essentially kind of boxed himself in on revenue during the campaign. He had made a statement that he would veto any tax increases. So Governor-elect Inslee has stated that he wants to look at ways we can make government more efficient through lean management and ways to grow the economy through jobs to bring in more revenue, and that he's not interested in looking at tax increases. That said, I think there could be room from that position as he comes into office and has an opportunity to really understand the challenges that we're facing. And one thing he did say that he wanted to look at was looking at tax breaks and whether we should be closing some of them. So those are considered by the 2/3 requirement. If you were to close one, it would be considered a tax increase. But that was one area that he said he was interested in looking at. But beyond that, there hasn't been any interest in looking at tax proposals, to my knowledge. Any other questions, comments?
Why don't we give people just another minute to submit their questions, if you have any.
Also, Betsy, if you want to flip to the next slide, I think it has my contact info on it, just so it's up if folks have any follow-up later and want to get a hold of me.
Okay, well, thank you for joining us today, and thank you, Kim, for the great presentation. Please join WSPHA in Olympia on January 23rd for our upcoming annual Public Health Education Day. Details are available on our website, including a sign-up sheet, and an agenda will be available shortly.